Hi, I'm so glad you made it back this week. If you're new to this channel, my name is Yolanda Renteria. I'm a trauma therapist, and I opened this channel with the intention of providing information. And one of my goals is that people start to understand that we actually make perfect sense, that everything about us makes perfect sense when we start understanding the impact our life experiences have on us. So this week, the topic is panic attacks. Actually, this is something that I really don't discuss on this platform, but it's actually something super easy to work through. And I work with a lot of people who have anxiety, and this is often one of the things one of the areas where we see like major changes when people start implementing the strategies that I'm just going to give you. Please, if you feel dysregulated or if you feel like this is too much, always consult with a professional. The tools that I'm going to give you, though, is things that you can usually find online, but I'm just going to give you the information that works really well with the people with whom I work. These are just tools and psychoeducation. It's not a replacement for therapy, and I think you all know that by now, right? So anyway, usually when people have a panic attack, it can be very scary. People experience panic attacks differently. So some people experience them with more intensity. And what usually happens is that they experience a lot of body sensations. Now, what I explain to people about panic attacks is that when they happen, something triggered a panic attack, and it might be completely out of our awareness, because the way that the body works is that it actually scans our environment for anything that might be possibly dangerous, and then it connects that information through our senses to our body. Then our body retrieves memories, like it compares it, like, oh, okay, like it can be so things that are so simple, like even a color, like, is this color safe? Is this situation safe? Is this person safe? Is this thought safe? Anything at all, it compares it. And if there are any memories that are triggers, it can have the potential to unleash a panic attack, or maybe just a lot of anxiety and a lot of body sensations. Now, when people first experience a panic attack, they usually go to the doctor because they feel like they might be having a heart attack, right? And the thing is that with heart attacks, heart attacks don't go away. So sometimes people, when they have a panic attack, they go to a doctor and the doctor says, everything's fine. Like, there's no problem with you. It's just anxiety. And then the person feels like there is an underlying health condition that hasn't been found, right? And it doesn't believe that it's just anxiety because the sensations just feel so real. And what I like to tell people is, like, if it was a heart attack, like, it would not have gone away. Like, the doctors would have actually identified it and told you, like, you were on the, like, on the verge of having a heart attack, or there is a heart problem, there is a heart condition. So usually doctors are pretty good at knowing when it's a panic attack. Always consult or get a second opinion, obviously. But if you're already like in your third, fourth, fifth doctor and you feel like they're just not finding something, the likelihood that it's a panic attack is very, very, very high. The anxiety leads us to believe that it's more than just a panic attack. But let me explain how I explain panic attacks to the people with whom I work. When our body is experiencing a panic attack, our body is experiencing exactly the same thing as it would experience if it were in a real crisis. So think about it, for example, like if you are in a natural disaster, right? Or I don't know, like if you're the victim of a crime, or if you're in a car accident. In that moment, your survival response is meant to kick in, right? So when it does, what happens is that your body has this rush of adrenaline that is actually built in so that you can take action. So if I am trying to survive a dangerous situation, it's actually very appropriate for me to have that rush of adrenaline so that I can do something with it. Maybe I run, right? Or I fight. And what the body does is that when I can't fight or fly out of the situation, if I can't remove myself or fight back, then my body will tend to freeze. So it uses that energy to freeze. When there is danger involved, though, we usually will reach a point where our body will again understand that there's no threat outside. So after like a real crisis, we can see that what was there, the danger is not there anymore. Well, when we experience a panic attack, the exact same thing happens with our body that happens in a real crisis situation. Think about the symptoms. You have a rush of adrenaline, you have a lot of energy in your body, you find it hard to breathe, right? Your heart is going really fast, you're feeling tingling, maybe even nauseous. And what happens in that situation is your fight-flight response was activated, but your body does not know what to do because you're not in real danger. So what you do is you look around and your body cannot detect anything in your environment that you have to fight, flight, or flee from, right? Fight, flight from, and it is confusing to your body. So your body says, well, if there's nothing outside that is dangerous, then the danger is inside. So then we are concerned that something is going on inside because nothing is happening outside. So one of the things that is so crucial to realize is that this is a panic attack. So naming it when it's present is key. Our body in that moment, basically the way that you can think about this is your fight-flight response was triggered. Your survival response, it thinks you're in danger, but it can't, like when it looks in your environment, there's no danger, so it doesn't know what to do, right? So it turns inward. So your job is to help your body make sense of what's happening. And the way that we do that is by naming it. So we first name it. I am having a panic attack in this moment. What I'm feeling in my body is sensations. My body's experiencing all of these adrenaline. So as a result of all of the adrenaline that I have that's usually used for fleeing or fighting, I'm getting all of these body sensations. My breathing changed because I'm on fight-flight response. So my natural response to that is going to want to be to breathe more, like get more air in, but I will try to abstain from it because what happens is that when you're breathing, if you get too much air, that's actually what gets you dizzy. Okay, so you want to avoid that actually, and you want to normalize your breathing. And what we do then is just allow all of the sensations to come in. And I know that might sound scary. I think most people usually what they do is they try to get away from what they're feeling, and so they try to move, or they're trying to find a safe space for them to just feel more secure. And although that can be helpful, that is teaching our body that there's something that is truly dangerous with our body. So it's actually giving us more adrenaline. I know, like it's giving us more adrenaline because it wants us to flee or fight, right? So one of the key things that I tell people is normalize panic attacks. And when they happen, just see it as that. Name it, say to yourself, like, this is a panic attack. Panic attacks don't last in intensity more than 20 minutes. So you could literally sit in one place for 20 minutes and all of that energy would drain out. Do you want to do that? Some people want to, some people don't want to. I always tell people, like, just allow it and feel it for a few seconds and just notice how it's just energy that it's moving through your body. And when you allow it, it just like kind of like does what it needs to do. There are other ways to help your body, but the main thing is do not be afraid of a panic attack, because that fear is fueling the adrenaline. So kind of like let your body know that you're in control, you know what you're doing, so that your body can make sense of it and it like starts to settle down, like it becomes more at ease with what is happening. Obviously, like there's a ton going on in your body, so it's not gonna feel comfortable, but it starts to make sense of it. So after time, like your body will realize, okay, this is just a panic attack. Like there's nothing to fear here. There's no danger. So let's just allow it and it will pass. When people do this, I find that usually panic attacks go from lasting a long time, 20 minutes, 25 minutes, or 20 minutes, 15, 20 minutes, to like 5 minutes. There's some people that when they've done this, like they start experiencing less panic attacks, because the body knows that when a panic attack shows up, you're gonna know what to do. So allowing sensations and understanding that it's a panic attack and these are just sensations is really, really key. The other thing is grounding. So there's different grounding techniques that you can do, but the one that I like to do is the 5, 4, 3, 2, 1. And how we do it is we look around the room and identify 5 things that you can see slowly, and then 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. Some people keep things around in their house so that if they have a panic attack, they know what to do, or they have like a little like sensory box so that they can use the objects in that box. Always keep in mind that it's really important to not be afraid of a panic attack. If you're trying to get rid of it, then it becomes worse. If you just witness it and accept it and say, like, I'm having a panic attack and this sucks, but it's going to feel better after a while, then your body will start making sense of it like that, and you will notice drastic changes with the panic attacks. Then it's also, I want to reinforce that it's really, really important to keep your normal breathing, because you're making the panic attack worse by breathing in too much. When people pass out, it's actually what their body needs to do. I know a lot of people are afraid that they will pass out, but if it does, it helps level the blood in your body. So it's actually what your body needs to do if you're in that moment. But most people don't pass out from a panic attack, because most people's blood pressure is really high when they experience a panic attack. Or it's higher than usual, you know. Not enough for you to have a heart attack, okay? They're not linked. This is really, really important. Then the other thing is tricks. So I have a couple of tricks, and I don't know, you can use it, you don't have to, but one of the tricks that I tell people is, if you basically pep yourself up for a panic attack so that when it comes, you say, like, I am ready for this. I know what to do. I know it's just energy. I know this isn't going to kill me. I know like how to manage it. I know how to ride the waves of the panic attack. Then actually your body realizes that you're not in danger, and it actually has the opposite effect. So asking for more sensation actually does the opposite. It's really tricky. I've had people with whom I've worked with who did it once, and they never experience a panic attack again, because their body was like, oh wait, like I'm giving you something that like it's happening and it's not dangerous. So what's the point of like having my fight flight mechanism activated if it's not dangerous, right? The other trick is I'm reading off my board here, but the other trick is actually understanding that the adrenaline that we have, okay, so the body doesn't know if your adrenaline is positive or negative. It just knows it's adrenaline, okay? So when you have the surge of adrenaline, it's the same adrenaline that takes place when you're excited. So some people have things to be excited about. So when they're experiencing a lot of anxieties or when they see a panic attack coming, they actually, when they kind of feel it coming, they actually think to themselves of something that they're really excited about. And then the body, like it tricks the body into thinking, then you're not scared, or this is not anxiety. It's just excitement. So something would be like, oh, hey, like I'm really excited about getting home right now and having my favorite meal, and just kind of like pepping yourself up for that excitement. And that tricks your body into thinking that you're actually happy. So anyway, I hope that you found this helpful. This is not like, this is something different, but I know that a lot of people struggle with panic attacks. So this is kind of like the gist of what I give people in terms of information and tools to deal with panic attacks. So I hope that you subscribe, not hope, but I hope that you're here next week. And please subscribe to my channel so that you can get more information. Thank you and have a good day. Bye.